The power of cognitive behavioral therapy in anxiety disorders. This is just the table of contents. So throughout this presentation, I'm going to discuss my problem statement, research question, literature review, theoretical framework, methodology, sampling design, procedures and measurements, limitations, implications, and then I have a reference page. Anxiety disorders are among the most common mental health concerns treated in social work. Anxiety often leads to impaired daily functioning, isolation, and decreased quality of life. Many clients experience persistent symptoms even after having access to supportive counseling. As a social worker, it is essential to identify evidence-based intervention that reduce anxiety symptoms and improve functioning. Cognitive behavioral therapy, or CBT, is a widely used intervention, but understanding its effectiveness compared to other interventions is crucial for guiding planning and improving client outcomes. For my research question, we have, in adults with anxiety disorders, how effective is CBT compared to no structured treatment or supportive counseling in reducing anxiety symptoms? The literature review highlights that anxiety disorders can greatly affect an individual's daily functioning, relationships, and overall quality of life. Research consistently identifies CBT as one of the most effective evidence-based treatments for anxiety disorders. CBT works by helping clients recognize and change unhealthy thought patterns and avoidance behaviors that contribute to anxiety. Standardized assessment tools such as the GAD-7 and the Beck Anxiety Inventory are commonly used to measure symptom improvement and evaluate the effectiveness of CBT interventions. This is my theoretical framework. So this study is grounded in cognitive theory, which is the foundation for CBT. Cognitive theory was developed by Aaron Beck and states that maladaptive thoughts and beliefs influence emotional responses and behaviors. So with anxiety disorders, individuals often experience distorted thinking patterns such as overgeneralization and excessive worry, which contributes to heightened anxiety symptoms. CBT therapy modifies dysfunctional thinking, which leads to a change in emotion and behaviors. So techniques such as cognitive restructuring, exposure, and skill building helps individuals learn to challenge irrational thoughts and develop healthier coping strategies. Behavioral theory is also embedded in the study. Behavioral theory emphasizes the role of learned behaviors in the development of maintenance and anxiety, such as avoidance behaviors. CBT addresses this through behavioral interventions such as the exposure therapy, which helps individuals gradually confront feared situations and reduce avoidance. Lastly, a biopsychosocial perspective supports this framework by recognizing that anxiety is influenced by biological, psychological, and social factors. The biopsychological perspective aligns with social work practice by acknowledging the broader context of the client's lives, including environmental stressors and social supports. So together, these three perspectives provide a strong foundation for examining how CBT reduces anxiety symptoms. Cognitive and behavioral theories explain the mechanisms of change the CBT produces, while the biopsychosocial model ensures an overall understanding of client functioning. So methodology for research design. This design would use quantitative quasi-experimental research design. This design would examine the effectiveness of CBT in reducing anxiety symptoms among adults with diagnosed anxiety disorders. The quasi-experimental design would be appropriate because study participants will not be randomly assigned to treatment conditions. Instead, they will be grouped based on the type of treatment they are currently receiving in outpatient clinical settings. This approach would allow for comparison between individuals receiving CBT and those receiving supportive counseling or no structured treatment while maintaining ethical and practical feasibility in real-world clinical environments. Sampling design. So the target population for the study will be adults 18 and older diagnosed with an anxiety disorder, including GAD, which is generalized anxiety disorder, panic disorder, and social anxiety disorder. Participants in the study will be individuals that are currently seeking or receiving mental health services in outpatient settings, such as community mental health clinics or private practices. The sampling frame for the study will consist of clients receiving services at selected outpatient mental health clinics within a defined geographical location. The sites will be chosen based on accessibility and the availability of individuals with anxiety disorders. A non-probability sampling method would be used. I think purposive sampling would be best used because participants must meet specific criteria. For the purpose of the study, these participants would be 18 years or older, have a clinical diagnosis of an anxiety disorder, and be eligible to participate in CBT. So this sampling would allow the researchers to intentionally select individuals who are most relevant to the research questions. Convenient sampling would also be appropriate as participants will be recruited from accessible clinical settings. So participants would then be divided into comparison groups, which is individuals receiving CBT and individuals receiving supportive counseling or no structured treatment. This design would allow for a comparison of outcomes related to anxiety symptom reduction across intervention types. Procedures and measurements. So participant recruitment. Participants would be recruited from outpatient mental health clinics, as I mentioned, that are identified in the sampling frame. So clinicians at participating sites would inform eligible clients about the study. Individuals who meet the criteria of being 18 or older, diagnosed with an anxiety disorder, and are currently eligible to engage in CBT or supportive counseling will be invited to participate in the study. Interested individuals would be provided with informed consent forms that outline the purpose of the study, the procedures, the risks and benefits, and confidentiality disclaimers. The study would be voluntary and participants would be able to withdraw at any time. For the interventions, participants in the CBT group would receive CBT interventions by trained clinicians over a 12-week period. Interventions may include cognitive restructuring, exposures, and other CBT skills. Participants in the comparison group will receive either supportive counseling, such as talk therapy, or no structured intervention. Data collection and analysis. So data for this research would be collected using standardized, validated self-report measures of anxiety symptoms that are administered at multiple time points. Research participants will complete assessments prior to the intervention, so at baseline, midway through treatment, which would be approximately 6 weeks into treatment, and then post-treatment, which is after the 12 weeks. Outcomes measured during these assessments would include the Generalized Anxiety Disorder 7, or the GAD-7, the Beck Anxiety and the Beck Anxiety Inventory. These assessments are widely used in clinical settings and in research because they have demonstrated strong reliability and validity in measuring anxiety disorders. In addition to quantitative measures, basic demographic information such as age, gender, diagnosis, and treatment history would be collected to describe the sample and any outlier variables. Data would be analyzed using statistical methods to determine whether CBT is more effective than supportive counseling or no treatment in reducing anxiety symptoms. T-tests would be used to compare post-treatment outcomes between the treatment groups. So then we have the measurement of effectiveness. So effectiveness for the study would be measured by the reduction in anxiety symptoms. The scores from baseline to post-treatment. I would define significant improvement of symptoms as a significant decrease in the GAD-7 or the Beck Anxiety Inventory scores. And then the ethical considerations would be, they would file the guidelines for research involving human participants. So the study would be approved by a institutional review board. They would have confidentiality maintained, etc. And as far as the implications for social work, so this study would contribute to the evidence of the effectiveness of CBT in clinical settings. These findings may help social workers make informed decisions about treatment planning and interventions for clients with anxiety disorders. This research would also enhance social workers' understanding of how structured interventions like CBT compared to supportive counseling, ultimately improving client outcomes. There are a couple limitations that should be considered when interpreting the findings for this study. So firstly, the study uses the quasi-experimental design without the use of random assignment. So this could potentially lead to questions about validity because participants are grouped together based on existing treatment conditions. This means that pre-existing differences between the groups may influence the outcomes rather than like the intervention itself. Second, the study relies on self-report measures such as the GAD-7. And while these tools are heavily validated, self-report data in general are subject to response bias, including social desirability and inaccurate self-assessment. So participants may underreport or overreport symptoms, which could affect the accuracy of the study. Lastly, we have the discussion and implications part. So this proposed study highlights the importance of evidence-based interventions, particularly CBT, and treating anxiety disorders. In finding, if findings support the effectiveness of CBT over supportive counseling or no treatment, this would further reinforce existing literature and studies identifying CBT as the gold standard intervention for anxiety-related disorders. One important implication for social work practice is the value of structured skill-based interventions. So CBT provides clients with tools such as cognitive restructuring and exposure techniques, which can lead to a reduction in anxiety symptoms. This study also emphasizes the importance of ongoing assessments and outcome measurement, such as using the tools, the GAD-7 and the BAI. Further studies could also explore long-term outcomes by including follow-up assessments beyond the 12-week treatment period. So this would help determine whether the benefits of CBT are sustained over time. And so overall, this proposed study has the potential to make meaningful contributions to social work practice and research by evaluating the effectiveness of CBT in reducing anxiety disorders. And lastly, I've included my references page, so thanks for watching.